we continue our Heart of the Valley effort to raise diabetes awareness. All month long, we've been bringing you important information about type 1, type 2 diabetes, knowing what symptoms to look out for, testing, and resources available. Today, our focus is on gestational diabetes. And joining us with DHR Health is OBGYN Dr. Flor Limas. Thanks so much for being here.
Thank you. Thank you for having me.
First of all, what is gestational diabetes?
This condition, it happens specifically in pregnancy. That, like the name says, gestational just means that it happens during the pregnancy. The inability of the mom's body to metabolize and really digest correctly the amount of carbohydrates or sugars that are ingested. So it ends up having a mom with high glucose levels during the pregnancy.
And how many women are impacted?
It varies depending on the region. I think in general in the U.S. as a whole it's in the round some numbers of maybe 10%. Here in South Texas, specifically the Valley, we see a higher number for sure. I believe a big part of that is because a lot of women are not diagnosed with type 2 diabetes when they get pregnant, and that's one of the first times that they actually go to the doctor and seek help and get tested, and so it is diagnosed in pregnancy, but it is way higher here in the Valley.
All right, so how far along in the pregnancy is it when a woman finds out, when she's diagnosed?
It depends. So in general, for patients that are healthy and no risk factors, they usually will get tested with a glucose exam by mouth. It's a juice that they drink, and it happens between 24 and 28 weeks of gestation, ideally. Now, patients that have risk factors, patients that have had diabetes in the prior pregnancy, patients that are obese, patients that are older than 35, or Hispanic origin, all of these women can get tested earlier at the beginning in the first trimester of pregnancy.
And once they're diagnosed, is this considered a high-risk pregnancy?
For sure. So this diagnosis basically brings a lot of possibilities and complications that can happen in the pregnancy and also in the postpartum period.
And how does this change prenatal care, or does it?
It changes definitely. So once you are diagnosed with this condition, then you have to be checking your glucose at home, making sure that there's a monitoring of what your glucose is doing depending on the time of the day and also on your food intake. These patients in general are seen closer in the clinic, more often visits than a regular non-high-risk patient, and they also can have more reasons to be sent to specialists and also to get further ultrasounds and do more extensive monitoring on the fetus.
So in addition to that, do they have to change the way they eat, their diet in any way?
Yes. So the first line of treatment or the first line of attack will be to change and modify your carbohydrate intake. So all of these patients have education in terms of what diet they should be sticking with, avoiding processed sugars and processed foods that can only increase your glucose even higher, and the monitoring at home as well. So all of them need to have dietary counseling.
And how does this impact the baby?
Oh, big way. So we have, when a patient is truly just gestational and they are not type 2 diabetics, but they just develop it during the pregnancy, these babies are at a higher risk of having other complications such as growing very big and being large for gestational age. These babies have macrosomia or problems where the mom has an inability to deliver the baby vaginally without any injury. They have higher risk of C-section rates. And also, of course, more possible complications of developing preeclampsia and other conditions in the pregnancy.
Okay, so you definitely have to watch this closely throughout the entire pregnancy.
For sure.
And once the baby is born, I understand that it goes away, does it?
So, yeah, the condition and the disease itself is for the mom. Of course, the babies can have also impacts in terms of how the glucose in the baby is, depending on how poorly or well controlled the mom was during the pregnancy. But for the baby, usually will not be a major issue that the baby will be born diabetic. They are at risk of developing diabetes later in life when the baby starts growing older. But right at delivery, we have other issues such as controlling their electrolytes and other levels in their blood. For the mom itself, majority of these cases resolve. They have to get tested. The moms have to be tested later out of the postpartum period to make sure that it went away. And some patients can stay, and at that time we convert them into a type 2 diabetic.
All right. Well, we thank you so much for joining
us
and taking the time to be here with us and educate all of us on gestational diabetes. Again, fighting diabetes starts with knowing your blood sugar levels and getting tested. HEB and South Texas Health System are offering free glucose screenings. Tomorrow you can go to any of these Upper Valley HEB locations from 9 a.m. until 12 noon. To get the most accurate reading, it's best to go on an empty stomach. If you can't make it out to any of these HEB locations, you can find the full schedule on our website, krgv.com. Just click on the Heart of the Valley button on our homepage. It's also available on the KRGV News app. We'll be right back.